Hello, everybody. For those of you who don't know me, I'm Janet Thompson. I live up in the Erie area, and I cover the northern, central, western tier of Pennsylvania. So for those of you who are part of that part of Pennsylvania, I am your membership liaison. My colleague, Katie Jordan, would be covering the rest of the state. And I want to invite and encourage you to reach out to Katie and I when you have questions. If there's things that you need or your physicians need, we welcome that. I wish that we were in person, but I'm excited to be here today, and I'm going to start my few minutes by giving you all kudos. So something that the Medical Society senior team has really worked hard on over the last several months is to make sure that we look at the things that are going really well and thank people for what they're doing. And so I'm going to turn that around and give you all a kudo because the last 6 to 7 months have been really challenging for all of us. And I am fortunate enough to be able to work from home and make sure that my child is safe, where many of you are going into work every day and you're making sure that your patients are safe and your staff is safe. So kudos to all of you for moving with the changes, with facing the uncertainties and taking everything as it comes. We are officially in our 2021 membership year. So some of you may have received your invoices. A few notes about invoices. So if you are receiving your physician's dues invoice, if you see any error whatsoever on that invoice, feel free to reach out to either Katie or myself or the Knowledge Center so that we can get that information up to date. If you are paying a group membership, so maybe you have more than one physician on your invoice and you are paying for those individuals. Again, if you see additions, deletions, changes, we really want to keep our information up to date. We also want to encourage you to add and remove those individuals who may either have joined your group or have left your group, because when you have 100% membership and you are paying for all of the dues for your physicians, you're eligible for discounts, and we want to be sure that you're getting those discounts. And the only way we can do that is to have the updated information. Katie and I are absolutely happy to talk to any of you about what that potential discount might look like. Maybe you have one physician in your practice that's not currently a member, and that physician joining could in turn give you a great discount and give you more access to our frontline calls, which are for 100% membership groups. And we'd love to help you with that. So as you are receiving your invoices, if you have questions, if you have changes, feel free to reach out to us. Also, we are still taking nominations for Everyday Hero. And some of you, if you follow us on social media or if you stay in touch with our website, you may have seen over the past several months that we have been honoring physicians, not necessarily just on the monthly basis. So that Everyday Hero Award, we have been honoring monthly for 3 years. And we've changed it through COVID, where we also have an award, which is the Everyday Hero on the front lines of COVID. So if you know a physician who is going above and beyond to help staff, to change some of the systems in your practice, to educate or assist your patients in a different way, feel free to nominate them, because we would love to honor them. We really enjoy seeing some of the things that have happened across Pennsylvania through COVID, and we're really proud of the work that our members are doing. And so please feel free to nominate either for an Everyday Hero monthly award or for the On the Frontline award. Finally, it's not on the agenda today. And again, I would encourage you to visit the website or reach out to the membership team or the Knowledge Center for CME resources. This is a licensure year. So for DOs, the license renewal is October 31st. For MDs, it's December 31st. And this has been such a strange year that there are many physicians calling us saying, oh goodness, I don't have my credits yet. And they are coming to us for those resources because as a member of the Pennsylvania Medical Society, physicians have access to several free CME opportunities. So we've got opioid, child abuse requirements, patient safety risk management, among other things. And so several of the hours that are required for license renewal are available through our website, free to members. And I really want to encourage you to share that with your physicians. I'm happy to help you do that if you need guidance on where to find it, or if you would like something written that we can share, we're happy to do that for you. So with that, I don't want to take up too much time, but thank you all for your support of membership. Thank you for showing up today. We know that this isn't the easiest way to do meetings. However, it is really exciting to see that we have over 150 people on this call. And that excites me because typically I would be talking to all of you in person. So I want to encourage you all to reach out to Katie and myself. Let us know how we might be able to help you from a membership perspective, or reach out to anyone from the Pennsylvania Medical Society team. So thank you for your membership. Thank you for being here today. And thank you for continuing to move with the changes that we are ever facing. I am going to turn it over to Dave Thompson. There is no relation between Dave and I, although we've worked together for almost 20 years and we often call each other siblings. So Dave is one of my longest colleagues, and he is going to give the legislative update today. Dave, I'm going to turn it over to you. Thanks.
Thanks, Janet. Good morning, everyone. Happy Wednesday. I almost said happy Monday. I can't keep track of the days anymore. They all seem to be the same. Let me share a few thoughts with you from a legislative standpoint as to what's happening. As all of you may know, at least I hope all of you know, we have an election coming up on November 3rd. That seems to be not only dominating your television with relentless advertisements on the presidential level. You'll start seeing more state legislative commercials, I'm sure, in the coming weeks. But as you might expect, that is dominating the legislative schedule as well. There are only probably about 10 or so legislative session days left before the election. Typically, we don't anymore have legislative session after the election, which is considered like a lame duck session. They've not done that for probably 10 or so years. There's talk that they may be doing that this year because of the budget situation. If you recall, the legislature did not pass a full year budget in June, this past June, because of the COVID and because of the fact that revenues were so dangerously low. They sort of passed a 5 or 6 month budget to get them, frankly, through the fall and through the election. And then I think the plan is, at least at this juncture, for them to come back after the election and pass a budget to get them through into next year. There's also a thought that they may not do anything and come back in March or April and pass ostensibly a 2-year budget. So we'll see. But the reason I mentioned is because what that really means to us is that, at least at this point in time, the legislature does not want to, nor do they have any appetite to make any tough votes because of the election coming up. So they're all very sensitive to issues, not wanting to alienate any particular block of voters in their districts. And as a result, there is a propensity to not want to make those difficult decisions and difficult votes. Not unusual. That's not unique to this year. It happens every election cycle. But this year seems to be a little bit different because of it being a presidential election year. But let me run down through a couple legislative issues that I think will be of interest to you. Some of them you've heard me talk about before, and I apologize for that. In this business, it's repetition in the context of bills take sometimes, especially if they're controversial, they can take several years, if not longer, to come to a head and be passed by the legislature. So with that, I will start with what I call the perennial favorite, and that is prior authorization reform. Again, nothing is happening per se legislatively on it. However, we did just have a meeting yesterday with the Senate chair of the Banking and Insurance Committee, where the Senate version of a prior auth bill is awaiting consideration. I don't believe that we will see any movement but members of our coalition, the hospitals, medical providers, we had a physician on the call. We also had a patient on the call talking about the difficulties they experienced with cardiac prior authorizations. But we had a lengthy call yesterday with Chairman Scavello and a couple of other members of the Senate to not introduce the issue to them necessarily, but just to kind of do a little bit deeper dive with them in anticipation of next session, when we're hoping, if we can't get traction in the House on this issue, which we have not thus far been able to do. We've moved the ball a little bit, but we really haven't even gotten past the 50-yard line. But my hope is that with yesterday's call, we've certainly piqued the interest of the chair of the Banking and Insurance Committee in the Senate. He had a lot of questions, and we certainly had good answers for him. But in any event, we're sort of hoping that that will at least stimulate some thinking on his part, and so that we come back in January of next year for the legislative session, he may be predisposed to running that bill a little bit sooner than what the House apparently is going to do. Nothing's changed, though. It's still the same piece of legislation, and nothing's changed with the insurers. They continue to oppose it, as I'm sure you all would expect them to do. Second issue is immunity. It's something that I think you've all heard about, whether it's nationally or here in Pennsylvania. A lot of talk about providing first responders to the COVID crisis. And there's talk about trying to get more immunity for physicians. If you recall, back in the spring, the governor did provide some limited immunity protections for physicians. Unfortunately, those protections were limited to physicians practicing in hospital facilities and/or ambulatory surgical centers. So it's not what we wanted organizationally. We really wanted across the board immunity for physicians when they were treating and making treatment decisions for patients related to COVID. But we didn't get it. We continue to push. The governor is sort of a lost cause on that issue. So we have turned to a broader coalition of business interests to get the legislature to do something. And we are embarking on that road right now. We have a piece of legislation, Senate Bill 1239, that would do just that. It would provide immunity protections for physicians, but it would also provide immunity protections for businesses, specifically those businesses that maybe had retooled their operation from making one product to making PPE or other items related to the COVID crisis. And they are asking as well for immunity protection. So we'll see where it goes. We're up against the trial bar on those issues, the personal injury lawyers, who certainly don't want anyone to have any immunity protections. But as you all know, and I'm sure have heard over the last several months, there are serious concerns that you will start seeing lawyers advertising for COVID-related illnesses, restaurants who didn't properly protect their patrons. All those sort of things, I think, will start to percolate at some point in the near term. So Senate Bill 1239 is aimed to provide some of those immunity protections. Non-compete clauses. Many of you are familiar with non-compete clauses in physician contracts. If you are in private practices, which I'm sure most of you are, you may use these non-compete clauses to protect your practice, to protect yourselves from physicians coming in and then being possibly poached by hospitals to come and work for them. And frankly, you're probably experiencing that as well with your nursing staff and other staff. So the Medical Society does have policy on doing away with non-compete agreements in physician contracts. I don't know what's going to happen with this issue. We do have a piece of legislation that was introduced. It is a piece of legislation that is an outright prohibition about using these non-compete clauses. We know that's problematic for some practices, certainly, who use them. It was really, quite frankly, aimed at hospitals who were keeping physicians from moving and going across the street to either another hospital or to go back out in private practice. But suffice it to say, I do not believe that you will see that legislation. If and when it does move, it will be changed. It will likely be changed to provide a little bit more flexibility, not only to hospitals, but also to private practices. So you may see language that would limit the non-compete to a smaller radius, maybe a shorter length of time. I know that one thing that has caused concern is when you are a UPMC physician, as an example, and you have a non-compete agreement within your physician contract, you are prohibited from practicing within a certain radius of any facility owned by UPMC. So in reality, that could prevent you from practicing anywhere in Pennsylvania, certainly west of the Susquehanna River here in Harrisburg. And I'm sure that's going to grow to potentially be statewide. So we're looking at some alternatives, but we're really in the infancy of that bill. It was just introduced a few months ago, but it's something I'm sure all of you have an interest in because of, again, using those non-compete agreements within the contracts you sign or have your physician sign when they join your practices. Test results bill. This bill was signed into law a couple years ago. It was Act 112 of 2018. This was the piece of legislation that mandated that any diagnostic imaging study, that the results be shared directly with the patient after the test results were read. And it had some language in there related to significant abnormalities. That was the trigger point to have the entity that was doing the study send a report directly to the patient. As you might all expect, defining what a significant abnormality is on a diagnostic imaging study is impossible. There is no definition for it. So we have been working, since that bill was enacted a couple years ago, we've been working to change that law, and we're in the cusp of doing that. We have a piece of legislation, House Bill, what is it here? I'm sorry, 2103. And House Bill 2103 removes the terminology significant abnormality. And it does some other tweaks to the bill or to the law. So it's not everything we wanted, but it's certainly a vast improvement over the other act that was done a couple years ago. And I think what you will find is if you're dealing with radiologists, if any of you are radiologic practices, et cetera, it will make things a little bit easier for physicians. It kind of takes the guesswork out of determining whether or not to send a report to a patient or not. Keeping in mind that sending the report to the patient can also include alerting them that it's in their patient portal, which of course is more and more the norm anymore today. It could also include an email as well to the patient. So that is something that has really been a burden to cardiologists and to radiologists over the last couple of years. We did have a piece of legislation pass that we supported earlier this year that would mandate that insurers pay for breast prosthetics when women undergo mastectomy as a result of cancer. And these custom prosthetics, I've been told, can be extraordinarily expensive, and typically insurance companies don't cover them. They do cover regular prosthetics, but if you are asymmetrical or there's an issue where you need custom prosthetics, the insurers didn't typically pay for that. This piece of legislation changes that. So the insurers now are mandated to pay for those custom prosthetics for women who want to use them after a mastectomy. The last bill I'm going to mention is House Bill 2779. This gets a little wonky, gets a little technical, but if you recall in the spring, the governor did issue a number of executive orders that in essence loosened some of the requirements for nurse practitioners, for physician assistants, loosened some requirements relative to telemedicine. All those issues were intended to be relaxed, those regulations relaxed a little bit so as to not prohibit care being available to patients, assuming we would have had an onslaught of COVID patients. Medical Society did not oppose the relaxation of those things under the pandemic emergency declaration, but this piece of legislation is problematic. It extends those relaxations of those agreements or those regulations beyond, currently I think the legislation says 6 months beyond the time period of the end of the emergency declaration. We don't think that's appropriate. Certainly it's fine to have it in effect during the pandemic emergency declaration, but not beyond that. So we're still working on that. Not quite sure what's going to happen. That bill could be considered today in the legislature, but we understand there's a few amendments that may resolve some of our concerns. So we'll see where that ends. The last thing I'll mention, getting back to the election and coming full circle, I hope all of you will vote in the upcoming election. Honestly, I don't care who you vote for as long as you exercise that right. I hope that your physicians who you work with will also be voting. And lastly, I'll mention something that we at the Medical Society's Political Action Committee, PAMPAC, has always tried to encourage physician practices to do, is give their employees a little bit of flexibility on election day to be able to go and vote, whether it's allowing them to come in a few minutes late in the morning or maybe a little bit longer lunch break. I know most of you don't take lunch breaks, but just give them every opportunity to go vote because obviously it's very important. So with that, I will end. Jen, if anyone has any questions, I'll be happy to stay on and answer them.
Hi, Dave. We do have one question here from Diane Detman. When you say the physicians have immunity protections for physicians treating COVID in hospitals, does that include all inpatient facilities, specifically skilled nursing facilities?
It does not include skilled nursing facilities, I don't believe. It only includes hospital facilities and hospital systems. But Diane, let me, I will check to just clarify that to be certain, but I'm almost certain that it only includes hospitals and not long-term care facilities. But I will double check that and give Deanna a heads up. And if there's anything different than what I just said, she can let you know.
Thank you, Dave. I have no further questions this morning.
All right. Thank you all. Have a great day. I'm gonna head to the Capitol.